Hey, it's Devin Burke, your guide to a peaceful night's rest. And in this episode, I'm going to be talking about cognitive behavioral therapy for insomnia and answering the question, does CBTi or cognitive behavioral therapy work? So let's get ahead and dive right in. So cognitive behavioral therapy is an evidence-based therapy, and it has been shown to be effective in controlled studies. It actually is a first-line defense for people that have chronic insomnia. So a lot of doctors just want to prescribe sleeping medication right off the bat, but really they should be prescribing and helping people get connected with CBTi practitioners because it can be very effective for certain people if the practitioner is skilled and really cares about their clients. The American College of Physicians recommends, again, that adult patients receive CBTi as a first line rather than sleeping pills. But it's so common when you have sleep challenges for doctors just to write you a script for, Ambien or Lunesta or Trazodone or Klonopin or whatever it is that they're writing scripts for without really, referring people that would greatly benefit from getting this type of psychological treatment as a first line defense. And between 70 to 80% of patients with primary insomnia experience improvements. So there is a percentage of people that don't experience improvements. And I think my opinion on that is depending, again, on the skill of the practitioner, depending on the willingness of the client, a lot of factors there that can dictate if CBTi will work for you. It also depends on the approach. And there's so many factors there. Again, finding the right person is part of the challenge because somebody could have the same tools, but just not use them as effectively as someone else. How long does it take for cognitive behavioral therapy to work? Well, usually it's about 8 weeks. Can be longer. Most clients can start to see improvements within 4 to 6 weeks, but usually it takes about 8 weeks for people to really notice a difference in their sleep. That's another reason why most people just go right to the sleeping pills because they're fast. They work fast, but they're temporary solution. They're Band-Aid solution. Really addressing the root cause with a method like cognitive behavioral therapy can be very impactful and very powerful. It can also be combined with several different approaches. In our Sleep Science Academy, we use CBT-i techniques as well as many other techniques from many other different places, such as mindfulness and acceptance and commitment therapy techniques, a lot of different techniques to really support people to understand their sleep and give them the tools to shift their sleep so that they can sleep without the need of anything chemical like sleeping pills. So some of the common techniques in cognitive behavioral therapy programs are cognitive restructuring, which essentially is a form of psychotherapy that really helps people identify the thoughts and beliefs that are creating the anxiety that's keeping them up. Some other connection, other devices and sort of methods, if you will, that cognitive behavioral therapists use are helping people just to connect their thoughts, their feelings, and their sleep, and how that relationship to sleep itself can be a major factor of getting and staying asleep. Interventions like relaxation training, stimulus control, which is not staying in bed when you're awake, as well as sleep restriction, which is a very challenging technique for a lot of people when they don't understand how to think about it and they don't have tools, the acceptance tools. This can actually be something that backfires if you don't have the right mindset, if you don't have the right tools and technology to really implement sleep restriction, which essentially is compressing your sleep window to increase sleep pressure. This can be a very challenging technique for people. And a lot of times people don't get the proper support that they need, and then they end up falling off the sleep restriction schedule, which then obviously it doesn't work. So there are some downfalls, but again, it just depends on the method and it depends on the level of support. So would cognitive behavioral therapy work for you? Well, it might if you can find somebody who is a great practitioner who really cares about their clients and really understands the ins and outs of this particular therapy. Love to hear your comments and questions. If you're watching this on YouTube, go ahead and just leave them below this video. If you're listening to this on the podcast, please consider subscribing and sharing this with someone who you think would benefit. And I will see you in the next episode.